Today, our guest is Samad Syed. Samad isn't just an entrepreneur, he's a pioneer in healthcare SaaS. As a founder and CEO of SRS Web Solutions, he has led innovations that have reached millions of patients and thousands of providers, from paperless digital patient intake to AI driven patient communication. A Forbes Council member and author of The Art of Patient Reengagement, Samad has been featured in Forbes, Becker's Healthcare, and Minneapolis St. Paul Business Journal as one of Minnesota's top software leaders. His journey from Six Sigma Master Black Belt at Cummins to building one of the largest healthcare software firms in the Twin Cities shows a relentless drive to streamline workflows and rehumanize patient care. With a mission to cut front office chaos and make healthcare simple again, Samad is reshaping the future of how practices run. SRS, by the way, turns 10 this November and is 2 times Inc. 5000 honoree. Proof that operational excellence can scale with heart. Welcome to Dental Tech Talk, Samad. How are you doing today?
Thank you, Youssef. Thank you for that amazing introduction. Appreciate it.
I like to hype my guests up. And honestly, that is all really, really impressive, by the way. You've done a lot in your career. Everything that I've mentioned is true. I've been looking forward to talking to you. You've done a lot in this space, a lot more to do. But as always, we'll just jump right into it. So, can you tell us a little bit about SRS Web Solutions first? What do you guys do?
mConsent is a patient engagement software primarily used by dental offices across the country. And the second one, Caretap, is an EHR system, which is electronic health record system, works primarily with community-based healthcare services providers. And when I say what does it mean by community healthcare providers? That means your home care agencies, mental health agencies, behavioral health agencies that are helping the community to improve their lives. We provide an EHR system to those. That's what SRS Web Solutions does. You mentioned this is our 10 years, and I was just talking to my wife and to my colleagues. Is like doesn't feel like 10 years. It went so fast. It feels like it was yesterday when we started this thing, and it's just amazing how 10 years goes.
Yeah, I mean, time flies, and happy birthday, I guess.
It's
Any
in
big plans?
November. November we're going to be 10 years, and yeah, it was an amazing story.
And so I'm very curious about the founder journeys, right? We'll get into the tech in a sec, but what got you into this space, right?
Sure. So my background is I have been in right after school. I got into a manufacturing segment, basically into automotive manufacturing segment, and I got trained. My brain got trained in corporate world to be efficient. To look for things that are wasteful in the processes, building processes, and looking for waste, and then removing that waste. And fast forward 2015, I happened to get into a situation where I had to go for a surgery for my hernia situation. And this is one of the largest hospital system in Minneapolis. And after I got up surgery, everything went well. We came back home. A few days later, I got bills. Basically, you start getting bills after that, right? So insurance covers what it covers, and after that you start getting bills. And for next 3 to 6 months, we kept just paying bills, and it wasn't very clear. There are like 3 different departments you're paying. And what we found out after 6 months is that I continued to pay this $1,800 bill. Every time we get a bill, we continue to pay. And my wife was looking at this as like, I think we're paying this like multiple times. Let's give a call. And I called them and I asked them, and they're like, you keep getting those bills? You have paid it like 3 times. So this was an error, right? So my experience was that experience actually led to our kitchen table discussion where I told my wife, like, this is a big problem because I have a lot of doctor friends and they continue to tell me the struggles of healthcare providers when it comes to administration part. So if you think from that perspective, the problem that I faced was not a clinical problem. Clinical is great. You have an amazing clinical services that's provided, but what failed was the operations part of it, administration part of it. And if you talk to any healthcare provider today, they'll tell you that most of our problems are administrative problems and very few problems are clinical problems. So our kitchen table conference was that I want to make this more human and remove errors from the system, right? I talked to a few doctors after that, and they said that, yep, you're right. We do have a problem, not just in billing, but we have problems everywhere when it comes to intake portion, taking care of the patients, follow-ups. billing, treatment planning, all that stuff is administration part. And we started discussing, and my brother-in-law is also a dentist. When he heard this discussion, he agreed to it immediately. He said that, come to my office, I'll show you the problems that we have. So he showed me a wall where they had like 35, 40 forms. I'm talking 2014, 2015, right? There are 30, 35 forms that they have to go through, depending on what patients they see. There are like 10 different types of intake forms. There are consent forms. There are a form for everything that they have to get consent for. So that led to, I asked one simple question: why are we not using technology to make things easy? And he challenged me. He said that, figure it out. I'll introduce you to 50 more doctors who are facing the same challenge. So that is where consent was born. We took that as a challenge, and that's what led to mConsent, which was of one of the first ones. I wouldn't say even one of those. We were the innovators of when it comes to getting your consents done on the iPad. Your patient check-in was using iPads and all that stuff.
Wow. It's very interesting because it stemmed from like your own personal experience. And
Yeah.
then, when you want to start a company, you want to find a problem to solve and then use cases to test it out on, right? So you ended up with the problem, the solution, and 50 doctors that are excited to work with you. So, yeah,
And
of
since
course.
then, we are patient first operations there, not only doing the intake portion of it now, but we do entire patient engagement, from appointment reminders to patient communication to payments to finance and everything.
That's amazing. So, since you mentioned mConsent, how does it connect to dental practice management systems to cut out the paperwork? Like, what does that workflow look like?
So great. The workflow is that, so we don't just look at paper. You go and talk to any practice and ask them, are you paperless? The way they're going to answer you is like, yes, we are paperless. But I'll explain you what paperless means. And then what we actually do is going to be clear. Paperless, for me, paperless, when they say paperless, they're actually stuck in manual digital, right? What they're doing is that they're sending out forms to the patients. It could be a PDF copy or link to the website, and they'll ask them to fill it out, right? And that's still chasing. I call it manual digital. They have a lot of manual work. There's a lot of chase happening in the office, but they're digital, right? And when the forms are filled out, then somebody have to go in and they have to update the medical history in the EMR, then they have to scan and they have to move everything, right? And that takes a lot of time, and that's a lot of chase, and that actually, those small things pull your office down. You don't see that, but I want you to think about this. If it takes 15 minutes for you to check in a new patient and you see 20 patients a day, you do the multiplication, it's 3 to 4 hours per day. You're just chasing all this stuff, right? And we, what we did is that we said that, okay, when we say automated, it's real automation. That means that the patient, our system reads who's coming into the office today, right? And not just today, but in 2 days from now. And we send out the paperwork before they come in. What it does is that we connect our actions to the KPIs. The KPIs could be like improving the show rate. So you know that if a patient is, filling out the documentation before they show up, that means, they're most likely to show up. The show rate improves. So that's how we connect. And then when the patient completes the documentation, literally the front office have to just say, yep, I got the documentation, and everything is in the system. You don't have any movement, no chasing, nothing. That's a real automation I talk about. Is like, one thing that we have been starting to push our offices is that 48 hours readiness program. I call it an intake process called as rapid intake. Rapid means like R stands for ready 48 hours before. So even before patient steps into the office, 48 hours before, think about it like checking your flight to make sure that everybody's coming onto your flight, right? Flight aboard. So we have a checklist that says a patient is ready 48 hours before or not ready. So if they're ready, that's a responsibility of your front office to make sure that everything that you need in the system is ready before they come in. So 48 hours before insurance verification is in system, yes or no. Your PDF copy of what patient has filled out with signatures and everything goes into your Smart Doc or DocuSign or images if it's open digital. It goes right in there. So that's what the rapid system is, what we talk about when we say. So it's not just like you're doing the forms, but we give a system to improve the life of the front offices.
Yeah, and I think it's also helping the actual patient because the patient experience is a lot smoother. You fill out your form ahead of time. You don't come in, sit in the chair. We all hate sitting on a chair with a paper and
I'll tell
filling
you
out
one
paperwork.
thing. One patient, he told this story is like to one of our clients is that I came to your office. I'm 100% sure now that what's covered, what's not covered, and what is it that I'm going to pay. So if they send out 48 hours insurance information to your front office and that's being taken care of, clarity, right? The clarity is a big thing. And if the patient is in your office and you're putting them in the waiting room, asking them to wait while your front office or whoever insurance coordinator is figuring out all that stuff, making call to insurance companies. That's not a good experience. You're just making patients wait and it's taking so much time. So getting it ready 48 hours ahead of time is a big deal. And that helps the offices and the patients both from the experience perspective.
Absolutely. Like everyone wins. So basically, just to kind of sum that up, patient journey, I get the form. You know what I like the most about this, Samad, is the actual, sorry, I jumped there, but the receptionist's job is so much easier because you're kind of structuring them and putting guardrails for them.
Mhm.
I like the rapid approach where, did they fill out the form? Did they fill out their insurance paperwork? By the time they come in, the doctor also knows what they need to do. And I could see how that reduces cancellation rates because if you go through the trouble of filling out the form, filling out the insurance paperwork and all this stuff, you're most likely going to show up. And if you don't, it's because of
Absolutely.
outside circumstances that are not under your control, right?
Absolutely.
And also, so with that said, I want to talk about Zaha as well, which is your AI receptionist. Sounds fascinating. I've had a lot of AI receptionist companies. I do think that the fact that you're already handling all these workflows and it's your 10-year anniversary gives you a massive edge in comparison to up and coming AI receptionist companies. Not saying that they won't do well, but how does it handle patient interactions differently from traditional front desk workflows and perhaps differently than other AI receptionists out there?
So, Zaha, I call it ops aware. It understands the operations of the dental practice, right? And it's not just chatty, but it also knows how to book, how to schedule, how to reschedule, how to get the insurance information. It knows the pricing, it knows the discounts. You can design it in a way where what your office wants, right? So you can ask ahead of time, hey, what's the insurance? What do we accept? What we don't accept? That is such an important information. So that's the difference is that we understand what are the flows that are out there that are important and needs attention. And eligibility questions, what do you need before the patient comes in? That's what Zaha understands. People usually ask me like, is that going to replace our front office? I was like, no. What it's going to help you with is that it's going to help your front office with all the frictions that they have to deal with on a day-to-day basis.
Really fascinated on the Zaha side. I do have a question. Do you do follow-ups as well? So is it outbound Zaha? Does it do the AI receptionist? Do you do follow-ups, patient confirmations, or is it more inbound, clearing the runway, like you said, for he or she, for the patients to land?
We focus on inbound right now. So the outbound, we can what we are working on right now is that on the outbound we are putting that with our unscheduled treatment plans. So there are a lot of times that the treatment is provided, but there's lack of follow-ups to make sure that the treatment is being signed by the practice by the patient. Sorry. So we do follow up using Zaha on making calls, sending out text messages, educating basically on the follow-ups. That's outbound.
You have a lot going on there. How do you ensure security, cybersecurity, HIPAA compliance, and data accuracy at scale when you're integrating across so many practices, so many patients, and so many digital systems that you're using? I'm sure your IT team's pretty amazing and a big foundation to what you guys are doing today.
Yeah, so we don't treat HIPAA as a paperwork. We treat compliance as it's like an infrastructure for us. So, proper encryptions in transit, at rest, proper access controls, privileges wherever absolutely needed, some privileges, design the privileges, audit logs wherever touches happens, having business associate agreements in place to cover the entities, to cover dental offices, and any of the vendors that are working. And what else is there? We use validation captures and all that stuff. So making sure that all the information that's important, the PHI information, is protected.
Yeah, and I wanted to go back to mConsent real quick. As a patient engagement tool, in your opinion, what differentiates it from other SaaS platforms that, claim to digitize? I know we kind of covered it, but anything else that really sets it apart?
Yeah. So what we look at is that not just only from the software perspective, as I said, that we look from the perspective of what KPIs need to improve for the practice. That's what we focus on. Okay, the practice need to improve its growth. We add treatment plan reminders. The practice need to get reactivate their patients' hygiene appointments. So we have a reactivation plans for them. Not our competitors don't focus on that. So that's why we say it's a complete patient re-engagement platform. Yes, everybody does the appointment reminders and texting and all that stuff. But what we tie up to is that what KPIs do we need to improve for the practice? Where are they struggling? And that's where we go in and we help them out and we tell them to focus on that first. And then we can focus on everything else. The intake part is the biggest challenge. In every practice, it's the biggest challenge. They think that they are paperless. They think that they can do, but the few things that I discussed with you, most of the front offices are chasing the patients. We tell them, do not chase. Let the system chase. You focus on the trust, building the trust with the patients, building the care that they need is what you need to focus on. So, that's how we differentiate. And also what we have introduced is a point of care kiosk. It's a hardware. The companies that are focused on the software, it's very hard for them to get a hardware introduced in their system. We added a kiosk, a patient check-in kiosk, where if there is a patient that shows up and he hasn't completed his documentation, now your front office doesn't have to chase them to make sure that the paperwork is complete. They can self-check in themselves. They'll get the information what is not complete, and they have to provide it sitting in the waiting room, rather than the front office have to provide them with a pad and all that stuff to complete the information, or an iPad or digital tablet to complete it. The kiosk takes care of the entire process.
Wow, very interesting and probably really helpful for the receptionist. And back to the re-engagement, do you also do patient reactivation? So basically targeting older patients that haven't come into office for a while to kind of get more people on the chair. Is that something you guys manage as well?
Yeah, so we help with the software part, where we provide training and we provide assistance, and also we automate the reactivation part. That if you have patients, so most of the software focus on who hasn't come to your practice in the last 6 months, they get automation. We look at 18 months is like why people haven't shown up for past 18 months, and our messaging is very human, meaning that we try to personalize it and educate it and help the patient understand why it's important for them to take care of their oral issues now rather than later. So that's what our reactivation does.
I'm curious about Caretap, right? You started in dental and then you started branching off into general healthcare, community healthcare, as you said, which is the first time I've heard that term, by the way. Learned something new today. When did you realize that your solutions were scaling beyond dentistry and into broader healthcare? And was that a hard pivot? Because founding a company is hard on its own, right? Building a business, it's hard. Anything that you do really is hard in life as far as business goes. But then you go and you pivot and spin off another subsidiary of the mother corporation or the holdings company, as you called it, to go into general healthcare. I mean, you're definitely a highly motivated human being, and it takes some guts. Because most people after founding one company, they're ready to tap after a few years, but then here you are spinning another one. So a couple of questions there. What led you to make that pivot? And
Yeah.
when did you realize, oh man, you know what, there's an opportunity here and this is something where I can help people, and decided to move that way?
Sometimes there's so many knocks on your door and you're ignoring, and then people start actually banging your door. So in 2017, 2018 actually, that's what happens. What happened was mConsent was focused on dentistry, working with dentistry, and we were helping out dentistry. And one of the home care agencies found out about the paperwork issue that we have been taking care of. And they have big compliance problems when it comes to like documentation and all that stuff. And I got in a period of 10 to 15 days, I got like 80 calls because somebody mentioned about what we does in a home care conference. And in Minnesota, we're focused, we're doing this work. And I got like 80 calls from this individuals. And I'm a hungry person. And I just wanted to make sure what's happening, what's wrong with this. That there are people they're so desperate to learn about how we are helping out from, taking care of the paperwork, helping with people with compliance, getting the signatures in place, digitizing everything in the practices. So when I got into it, what I found out was they actually don't have an EHR system to work with. And the market was pretty solid, big. We focused on one single state, which is state of Minnesota. And then, it took us some time, but we were able to build it and the demand was there. I mean, the amount of work that you have to do to generate demand, we didn't have that problem. So that was wonderful thing that happened. And we were able to put this company together now.